Let me read this one as well. A nurse is assisting with the care of a client who is receiving total parenteral nutrition, TPN, therapy and has just returned to the room following physical therapy. The nurse notes that the infusion pump for the client's TPN is turned off. After after restarting the infusion pump, the nurse should monitor the client for which of the following findings. Now, are you familiar with total parenteral nutrition?
That is it not? Is it not the same thing as the G tube?
No, it's different, but it's related to nutrition in that same regard.
Okay.
Let me explain, okay?
Okay.
Hold on, excuse me. Okay. When you have a patient, we discussed the GI tract, right? Okay.
Yeah.
And then we started, the small intestines, large intestines, all that stuff, right? I think now I could draw it really fast, but you understanding what I'm talking about, correct?
Okay. Yeah.
Generally speaking, when somebody has a hard time with nutrition, there's a few things that we can do. The first thing is that we change. This triangle means change, by the way, okay?
Yeah.
Sometimes when a patient cannot receive adequate nutrition, we change the texture of food. We make it mechanically soft. We mechanically alter it. We make it pureed. We thicken the liquids, all that stuff, correct?
Yeah.
But sometimes the patient still gets so sick that they can't even have PO at all. They can't have anything by mouth. So at that point, their nutrition starts to decrease. They get very skinny. They get unhealthy. At that point, we start thinking about enteral feeding. And all enteral means it's through the GI tract, okay?
Yes, sir.
In order for a patient to have enteral feedings, they have to have a functioning GI system. And for the most part, our patients have functioning GI systems. And we can either do a PEG tube through here. And, this is the abdominal wall, and they have a G tube, right? Or we could do an NG tube, correct?
Okay.
Those are all kinds of enteral feedings. But there are now, and that's fine. We can do that. But then we have some patients that they cannot tolerate that for whatever reason. They have an underlying disease or disorder where their GI system is not functioning. Does that make sense?
Okay.
So at that point, we do something called parenteral nutrition. That is not through the GI tract. That's through the vascular system.
Oh.
Okay. That's what I'm looking for. Oh, that's exactly what I'm looking for, because that means that you came across something that makes a little bit more sense. Mm-hmm. And this is why we call it total parenteral nutrition. Because let me explain something, Mr. Tayo. We also have a lot of capillaries on top of our intestines.
Okay.
Because as the nutrition passes through the intestines, they get absorbed by the blood vessels, the capillaries. Let me explain. Imagine this is the colon, right? Or an intestine, right?
Yeah.
And as the food is passing this way, we have these cells all inside of the wall of the intestine.
Okay.
Okay. And we have blood vessels, we have capillaries. And remember, we discussed that capillaries is where exchange of gases and nutrition occurs, correct?
Yes, sir.
So as we start eating our cheeseburger, what's one of your favorite? Where are you from, Mr. Tayo? I forget.
I'm from Nigeria.
Okay, from Nigeria. You guys eat some plantains, right? Fried plantains?
Yeah.
Delicious. My mother's from El Salvador, so we eat the same thing, man. It's wonderful. So when we're eating those plantains, man, they're coming in through here, and the acids in our stomach and our chewing breaks down all the fibers of the plantain, and they're broken down to the molecules of nutrition, meaning proteins, carbohydrates, fatty acids, correct?
Yes, sir.
Those elements, Mr. Tayo, are represented in green right here. They are absorbed by those cells, and then they are transferred to the capillary system. And that's how we have nutrition in our system. That's how we have proteins, sugar, all that stuff. Does that make sense, sir?
Yes, sir.
But in certain circumstances, our patients may be sick and they may have a non-functioning GI system. So we have to give them nutrition straight into the vascular system. And we call that parenteral nutrition. Does that make sense?
Yeah. I got it.
Good. There's two types. There's total, or what we call TPN, and there's partial, PPN. Okay. All that means that this is more complete than this one. This is half complete. Make sense?
Yes, sir.
Okay. That's what this TPN or PPN is going to be. Any questions on that, sir?
I got it, sir.
All right, good. I'm gonna leave that here just for a little bit. Let's see if we can play with this a little more.
Okay.
So it says, a nurse is assisting with the care of a client who is receiving total parenteral nutrition. And by the way, they receive this through, this is their arm. I'm just gonna draw 4 fingers, okay? You understand that we have it like this. We have the heart right here. Mm-hmm. We have the superior vena cava. So when we give TPN, sir, or PPN, we have to put it's not a regular IV line. It's an IV line that goes all the way to the brachial vein, all the way to the superior vena cava, like this. So it drops the medication straight into the heart. And those type of lines are known as PICC lines. You've heard of PICC lines?
Okay, yeah.
It's a peripherally inserted central catheter. I'm gonna write it down right here. And that's your PICC line. The reason why we have PICC lines compared to regular just IV lines is because the PICC line can be left in there for up to a month or more. Versus a regular IV line, the ones that we start, you're IV certified, correct?
Yeah.
Those ones we can only keep for 72 hours. But our patients that require TPN, they're continuously receiving their nutrition through this peripheral line. So we have to give them a line that we can leave in for a longer period of time versus poking them every 3 days and causing infiltration, phlebitis, all the complications, right? Does that make sense, sir?
Yes, sir.
Okay. I want you to understand that the solution, let me draw my whiteboard now. The solution that's found in TPN, in TPN or PPN, it's highly concentrated nutrition. What that means is the plantains that we were talking about, or the tacos that I eat, or the pupusas that I eat, or whatever we eat, all the nutritional elements, proteins, carbohydrates, fatty acids, enzymes, vitamins, glucose, all of that stuff is concentrated in that solution. So the patient may develop an increased they may develop hyperglycemia because all that nutrition is being sent straight into the bloodstream. Does that make sense, sir?
Yes, sir.
Okay. Any questions so far?
No, I got it.
Okay. Clear this out. So then we go back to the question. It says, the nurse is assisting with the care of a client receiving TPN and has just returned to the room following physical therapy. The nurse notes that the infusion pump for the client's TPN is turned off. And you know the infusion pump, right? It's just a regular infusion pump. That's how they're administering the drips. Yeah. After restarting the infusion pump, the nurse should monitor the client for which of the following findings. So which of the following do you think that we should monitor for when someone's having their TPN started again? And take a guess. It's okay because I'm going to explain it to you anyway, if you don't know.
Yeah, I would take D, diaphoresis.
Diaphoresis, final answer?
Yes.
And this one is correct. So check this out. Because look, it says...
I don't know the meaning of diaphoresis, but I know the fever, hypertension, excessive test. That's why I just chose it.
Let me tell you something, sir. Okay. You just did something that's very important. You don't necessarily have to know the answer to all these questions. You have to have a foundation that can allow you to eliminate the things that are not it. And that's called deductive reasoning. Diaphoresis is excessive sweating.
Sweat. Oh.
There's a lot of sweating.
Diaphoresis. Oh my God.
And the reason why is because you're introducing all of that nutrition into the blood system, and it almost shocks your system like, whoa. And it causes what we call sympathetic action, and it causes you to sweat a little bit, meaning a little bit of fight or flight. You're introducing concentrated nutrition to the vascular system, which shocks your system, and you might sweat a little bit. Does that make sense, sir?
I got it.
Okay, let's see the rationale. The nurse should recognize that the client has a potential for the development of hypoglycemia due to the sudden withdrawal of the TPN solution. Remember how I told you that the patient that has the solution, they may develop hyperglycemia, correct?
Yes, sir.
So again, the solution has a lot of glucose in it. Your blood sugar may be high. But what happens when the patient's doing physical therapy and they're not connected to the TPN? Are they receiving that glucose?
They're not.
They're not. And what's their body going to do to the glucose that was inside of their blood before they were disconnected? Isn't their body going to release insulin?
Yeah, it will reduce insulin.
So that short time period that the patient was off of the connecting tubing to the TPN, during that time, because they were physically active, that may cause hypoglycemia. So that, and diaphoresis is one of the signs and symptoms of hypoglycemia, because when you're hypoglycemic, your body I'll explain that later on. But my point is diaphoresis is correct. Because look, it says right here, the manifestations of hypoglycemia, again, manifestations of hypoglycemia could include weakness, anxiety, confusion, and hunger, including diaphoresis.